on the operating table for hours and usually have their arm extended can really bring a lot of pain to related muscles. So today I would really like to address like some of the major muscles that get affected with scar tissue and are tight. So that would be the pectoralis major, minor, serratus anterior, the four rotator cuff muscles, specifically the supraspinatus and the subscapularis, obviously the deltoid and also the lat. So I am going to demonstrate on our model, and some clients cannot, raise their arm. So what I do is I usually put a pillow right here, but she can. So we're going to place her arm right here where it's comfortable, supporting with a pillow behind her. And I am going to go ahead and undrape her because I want to show you right here. Pectoralis major is one of the muscles that really gets damaged. When they remove the breast tissue usually is attached from the second rib all the way down to the sixth rib. So all of this breast tissue is covering most of the pec major and the serratus anterior. So this is the origin right here on the sternum and on the clavicle. This is the origin of the pec major, and it inserts here on the humerus. And then the serratus anterior originates here from all the way from the second rib to the 8th or 9th rib, and it inserts on the anterior lateral side of the scapula. So all this muscle here, the muscles here, really get tight and they start forming scar tissue. So some gentle strokes to help them really stretch some of this muscle just real gently. So we're actually working with a superficial fascia, and that's what forms scar tissue. And the superficial fascia is what encases every muscle, just kind of like the pillowcase encases a pillow or the sock over your foot. So it encases every muscle, and if it starts healing wrong and forming scar tissue, it'll limit the range of motion and it'll limit the blood flow to the area. And blood flow is really what brings nutrients to the muscle with the oxygen and nutrients. So you want to make sure and address the pec major, the serratus anterior, the subscapularis, the deltoid, the supraspinatus, infraspinatus, teres minor, and the lat. Those are the muscles that are really affected with the mastectomy. So I think it's very important to teach your clients and show your clients that a lot of the pain that they might be having is due to the fact that their muscles are tight and not necessarily to the cancer, because I'm pretty sure that it's very scary, if they can't raise their arm or they're really having trigger points, or along the serratus anterior or the pec, and it could be just the muscles, the soft tissue, and it doesn't have anything to do with, with the cancer.